Uh, 1 minute. So, yeah. So what the chapter basically means, the introduction. So anyone playing any sport at any point, so during the sport, his or her safety should be their first priority because no one wants them to get injured. Because imagine to play, to score a goal or to do something good for a team, if they put themselves into danger, then they'll get injured and then they won't be able to play for the rest of the time or for the rest of the game, which will be harmful to the team and which will harm themselves. So, and any kind of threatening, discrimination, or violence is not acceptable in the field of sports. It's natural to get injured in sports, but it should be avoided as far as possible. The main focus should be not to engage with major injuries like fractures and brain hemorrhage and all, but minor injuries like muscle pull pains are common for sportsmen. So, types of sports related injuries. So, muscle strained or also known as pulled muscle. So, muscle strained or pulled muscle occurs when your muscle is overstretched, when your muscle is overstretched or torn. So, basically, imagine you're running and you stretch your leg too much. I mean, when you're taking your leaps and you take a very huge leap and your body is not used to taking such a huge leap. I mean, when you usually run, you don't take such a huge leap. But suddenly, you think that if I take a huge leap, I'll win or I'll start running faster. So that's when your muscle is overstretched or torn, and that affects your corresponding muscle or the attaching tendons. So muscle is basically attached through tendons. So either the muscle will be overstretched and torn or the tendons will be affected. It usually happens when you see any muscle, when you use any muscle in your body carelessly. And it can happen in any muscle, but mostly occurs in hamstrings, thighs, back, or neck. So now why hamstrings and thighs? Because when you're running, hamstrings and thighs are one of the two main parts of your body which help you run. When a muscle pull occurs, there will be pain, and the muscle will restrict its movement. So you'll have pain over there, and you won't be able to move that muscle. You will observe swelling and stiffness. So that's obvious. Serious muscle injuries can develop over weeks and will restrict even complicated movements, and the pain will be more. So imagine you have a very serious injury, then it's not like in one day the swelling will increase and all, but over the weeks your pain will increase. You won't, and over the week movement your movement will be will start getting less and less. First aid for muscle strain. So first aid for muscle strain is basically what should we do when we have a muscle strain. So price procedure, this is the name of the concept. The injured area of the sportsman should be supported to prevent, I'm sorry, the T is not there, to prevent any further injury. So in the sense, imagine you have a muscle strain on a thigh or hamstring, you need to support it with, for example, with a crepe bandage, so that it's the crepe bandage supports the area and there's you give support to the injured area. Rest is the best medicine for any kind of injuries, as you will allow that part to heal on its own, and you also need to control the temptation that for that particular muscle. So basically, what do I mean by control the temptation for that particular muscle? So imagine if you get hurt on your hand or something, so hand or hamstring, whatever. So that temptation to move it should be least. I mean, as less as possible, as less as possible, because y- if you move it and you keep moving it, you keep walking, then it won't heal, or and it may just damage itself more. As soon as the area of injury is identified, ice should be applied to prevent bleeding, more swelling, as it slows down the blood circulation. So as soon as you get to know that this is where it's paining, this is where I've been hurt, you need to put ice so that it slows down the blood circulation and prevents bleeding, and it decreases swelling. Ice relaxes the injured area and it should be applied depending on the intensity of the injury. So imagine that you have got hurt very badly. So you need to put ice at least 4 times a day for 20 minutes. And if it's a normal sprain or something like that, then you just need to put it twice for 10 minutes. So it depends on the intensity of how much badly have you got hurt. It should be wrapped around a wet cloth and then tied around the injured area. So imagine you've got hurt on your hamstring. So then take a cloth, put the ice pack in the middle, and then place the ice pack on the injured area and then tie it around. Compression. What is compression? Is basically pressurizing that part of the area. I mean, basically the pulled thigh or hamstring, which best reduces the bleeding or swelling. It is generally done by putting a tab over the injured area. The compression shouldn't be very hard as it can disturb the blood circulation majorly. I mean, it shouldn't be hard because it may just stop the blood circulation and you can have other side effects. Elevation. So this is also first aid for muscle strain. So it's preferable to keep the injured limb or elevated or in the elevation of the height of heart. So basically, imagine you've got hurt on your hamstrings. So if you're just sitting, like normally sitting, like you're sitting on a chair, then all the blood will flow down to the this thing thigh. And as I said before, that blood circulation is not good because it'll start bleeding. And it's not even like that you need to keep your leg high up in the air. So basically, keep your leg straight in the line of your heart so that the blood circulation is smooth and there's neither bleeding nor loss of blood. In the sense, loss of blood circulation. For the few hours of the injuries, the sportsman should avoid hot baths, exercising, running, or any kind of activity which either releases heat or absorbs heat. Because heat, hot, all this kind of thing is not it's not good for the injury. Every day, some movement advised by the doctor should be done in order to keep the muscle or that limb active. So you got hurt, it's not like you're just gonna leave it. You have to keep it moving some day with whatever your doctor prescribes, and keep that limb active and keep exercising that limb, not yourself, but that limb. So this is the second kind of injury. It's known as torn ACL. ACL stands for anterior cruciate ligament. It is one of those four ligaments in the bodies which provides stabilization. It is located on the inside of the knee joint. It is a third or second degree sprain. It is majorly responsible for preventing the thigh bone, femur to slide back into the tibia. So basically, the thigh bone, the longest bone in the body, femur. So this ligament supports it so that it doesn't slide back to the tibia. Without the ACL, the knee becomes unstable and it occurs with a sudden change in direction. So imagine if the ACL is not there and so the knee becomes unstable. And this happens when, imagine you change your direction suddenly. You're playing football and suddenly the ball stops and you change your direction or pivot against a locked knee. So when you're running and if you have knock knees and your knees knock each other, so then you might just fall. So that's when the ACL makes the knee unstable. Common symptoms of ACL are pain and swelling. So the injury is common people who play volleyball, basketball, gymnastics, and at some point football. So basically jumping. Basically, it occurs due to the improper landing. Improper landing when we in basketball, when we jump up to get a rebound, and when we come down. So when our leg twists, now this is the most common injury we have in Sayadri. When we jump up, we come down, and then our leg twists. So that's what torn ACL is. Suddenly stopping in motion or a collision with another sportsman. So that's pretty much self-explanatory. There's a popping sound when something of this sort is occurred, and it's more prone to happen in women than to men due to different anatomy. So it's more likely to happen with women because of the different anatomy. Swelling starts developing over the hours and it's probably difficult to walk. In some cases, it becomes absolutely impossible to walk or flex. So, as I said, when you have a torn ACL, the swelling will develop, the pain will develop, and you'll have difficulty in moving. The movements will be restricted by the ligament. So, first aid for torn ACL. Don't try to move the joint after the injury and make sure you sit in a comfortable position. So it says to make sure in a comfortable position because you have to make sure that you don't keep changing your positions all the time. Any bleeding could any bleeding could be stopped with a clean cloth and by pressurizing that point to stop blood flow. So basically compression and bleeding. If there is any bleeding, then a tight cloth should be tied around the injured area. Keep your knee in an elevated position to make blood flow easier, as I said in the other slide. Ice pack should be immediately applied to prevent bleeding and swelling. Compression should be done occasionally, and painkillers should be applied for severe damage. So painkillers should be taken if there's extreme or severe pain, and compression should be done occasionally so that the blood pressure is stabilized, the swelling is stabilized, everything is stabilized. So, yeah, torn MCL. So, it stands for medial collateral ligament, and it is responsible for various injuries of the
Medial.
knees. So, what did I say? I
Medial.
said medial.
You said medical.
Oh, sorry, medial collateral ligament. It is a ligament which helps in stabilization of the knee. It prevents the knee from bending inwards. So, I mean, we can't bend our knee inwards because of this MCL ligament present. Yeah, it is one of those four important ligaments in the knee, and one of its end is attached to its tibia and the other to the femur. A torn MCL can destabilize the knee and can prevent the twisting and turning of an individual. These usually occurs in activities involving twisting, turning, and quick changing of directions. So, I mean, sports, basketball, any kind of sports which include jumping, weaving, and stop and move movements. It is a common injury in contact sports. So, there are three grades of MCL. First, it is stretched. Second, it is slightly torn. And third, it is completely torn. So this is the grade, and I mean, with moving downwards, the intensity increases. Soon after the injury, you will observe high swelling and enormous pain, and at some point, the individual won't be able to take weight on that leg. So this is, you know, it's more serious than ACL. And after you've after you've got this injury, MCL, you'll start having enormous pain, swelling, and it's not like swelling will develop over hours. You'll start seeing the swelling, immediately after the injury. So, first aid for torn ACL. As soon as the injury is identified, don't try to move that joint. Otherwise, it will lead to increase in the damage of the ligament. Proper rest is needed. Ice pack should be applied as soon as possible to decrease swelling and prevent bleeding. Apply compression bandage to prevent the inflammation of the joint. So when inflammation of the joint means so that the joint it's broken or it's torn, so it doesn't start expanding. So for it to doesn't expand, we need to tie it around with a compression bandage. If possible, keep the joint elevated in order to maintain blood flow for more smoothly, basically in the line of heart, so the blood flow is smoother and easier. Anti-inflammatory medicines need to be consumed to attain relaxation and minimize swelling. So in the torn ACL, it's inflammatory. The inflammation of the joint is very common. So these medicines are prescribed by the doctors. So this is the third kind of injury. Shin splints. Shin splint is any injury which is felt along with the shin bone from knee to ankle. The pain felt on the inner side of the shin bone is called medial shin splints, and the pain felt on the other side of the outer side of the shin bone is called anterior shin splints. This injury is common in sports which include running and jumping. So there's nothing to explain much, but it's just that any injury which occurs in that part mentioned there are called shin splints, and it's very common. So example, like you see this girl move, the way she's running, so her legs are facing inwards and they are supposed to be facing straight, but they're facing inwards. So this is when these kind of injuries happen because due to wearing wrong size shoes or improper technique of running. Yeah, stress fracture. Fourth, so I didn't write about the first aid for shin splints, but because it's exactly the same as torn ACL. Stress fracture. So fourth kind of injury is stress fracture. So this is the most common word we've heard. Fracture. Stress fracture, fourth kind of injury. So these kind of fractures are common in long distance races, basketball, football. So these injuries could also occur due to changing running tracks. For example, from running outdoors to running on a treadmill. So imagine you've been, you've in a habit to run outdoors, run on the field, keep you run across the country and all. So and suddenly due to this lockdown, you start running on the treadmill and you're not used to it, completely not used to it. So a stress fracture, you are totally, you know, uh, inviting this kind of fracture to yourself because this is a major uh, point in this stress fracture, that this injury also happens because of changing running tracks. It also happens due to the improper technique of running, poor conditioning technique. I mean, yeah, same thing, but then poor conditioning technique. So as I showed in the earlier slide, the girl was running. That was a poor conditioning technique, and the improper technique. So you know, people who don't know how to run, they've started new, so they don't know exactly how to run or what's the right technique. So these kind of fractures are prone to them. So these injuries usually take place in leg bones and are more prone to females than in males due to the low bone density. So basically, females have low bone density due to the change in, I mean, due to the difference in anatomy, and that's why they are more prone to it than men. Yeah. Fracture. So this is the most common word we've heard. Fracture. Fracture basically means a break the continuity of the bone, and it can range from minor fracture to a major fracture. So almost at least two of us have been experienced with a fracture, and we all know how it feels like and what is it like. So they can occur in any bone in the body, and the types of fractures range from compound to complicated. So they mostly occur due to heavy impact or pressure which causes the bone to break. So imagine, yeah, so the two of us who've got fractures, so we got it because we were, we were goalkeeping, and then someone who shot the ball, and our hands were straight. We were trying to save the ball, but the ball was coming so fast that it hit our hand. So it was a very, very heavy impact on our hands, and the bone couldn't resist it, and it broke. So after getting the fracture, you will get swelling, have severe pain, redness, stiffness, joint movement will be restricted. All that will happen. It's pretty self-explanatory because we all know what a fracture is like, and we've seen it or either we've have had it. Plantar fasciitis. So this is the fifth kind of injury. So it's a common painful foot condition, and one of the most common causes of the pain in the heel. Heel is basically the palm of the foot. It causes the inflammation of the thick band of tissues which run under the foot and connects the heel bone to the toes. So it may not hurt after you have walked enough, but as soon as you stress your foot more and more, it will pain as much. It usually occurs due to obesity, increased activity, and very high arc persistent running. So what does it mean, a very high arc persistent running? So when you're running, and as I showed you, that girl who was running with her feet inwards. So imagine, so this happens if you're running with your feet extremely inwards, or if you're running with your feet extremely outwards. And also when you're not wearing the right shoes, so not right size shoes, or not, not the shoes which are meant for not meant for sports, all that. So, so in this injury, what happens is the inflammation of thick band of tissues which run the foot are inflamed. So when they are inflamed, the muscles, the tendons, they all start getting, detached, and that's when the injury takes place. So yeah, my presentation was still here now, but Anjali will continue.
Ankle. So like all of us know what a sprained ankle is like. When you twist your foot in one way or the other, it swells up, right? So it's basically that. Like our ankle has a particular range of motion So as you can see in that picture, there is some degree to which your ankle can move, but if it is forced to move further than that by anything else, like when you land, if your foot is twisted further than it naturally can, then the tendons in your feet, in your ankle, they can get damaged. So like, so first aid for that is it's like rice, but only the rice part of it. So you rest it, so you don't put any weight on it, you don't use that tendon anymore, you let it be, you leave it, and then you apply ice, like Madhav said, you wrap it in a cloth and you put it, so it reduces swelling and it slows down the blood circulation. Then you compress it, like like we wear crepe bandages and anklets and all that, so it provides a compression, so it reduces the swelling, and it also stops, it prevents the movement of the ankle. Then elevation, again, like Madhav said, you elevate it above the heart level. Then tennis elbow. So the tendon you see there, which is attaching to your which is attaching to the elbow, that is the one which gets affected. Like, it doesn't have to be torn, but that's where it gets damaged, and from there it hurts. And it's called tennis elbow because in tennis this muscles and this tendon is used a lot, and it is caused when this muscle is overused and is stressed. So here also you rest it, so you don't move that muscle and tendon in anymore. You apply ice on the part which is hurting. You provide support, like you hang your hand with those things. I don't know what they're called, but you hang your arm there, so your muscles are not used, so they get time to relax and repair. And you take anti inflammatory medicines which reduce the swelling in the elbow. Then there is lower back pain. So this is a very common disorder. It can happen due to anything, like if you stand for too long, if you sit for too long, if your back is bent for too long, so any of that can cause lower back pain. So even here the thing is rest, but not for very long. So if you should rest, you should give time to your back muscles to relax and repair. But if you do that for too long, it will start hurting even more. It may start hurting more. So also earlier Madhav said that you have to keep them active, the muscles which have been damaged, even though they've been damaged, you have to keep them active in some way or the other with the exercises the doctor tells you to do. Then you put ice on your back, again, to reduce swelling and slowing down the blood, and compression. So you have these waist bands, and you take medication which the doctor gives you. Then this is hip brucitis, bruciti- brucitis. Yeah, okay, whatever. So that thing you see there, the tro trochanteric bursa, that's like a muscle on the on the head of your femur. So that is the one which is stressed and it hurts. So the pain originates from there, and it can go down to up to your knee. So again, you rest your leg, you don't move it, you don't exercise that muscle, you put ice on it and you take anti-inflammatory medicine. So then concussion. So like this is like a this is when your head bangs against something or something hits your head. Like for example, your head hits a wall or some ball or a bat or something comes and hits your head. So this is where your head has a sudden movement and your brain sort of smashes against one of the sides of the skull, and it causes nausea and disorientation and all of that. It can also cause like serious damages like memory loss and stuff, brain damage and stuff like that. So this is a pretty serious injury. So first of all, you immobilize the head. So you stop any movement of the head. So you make the person lie down and keep their head on a pillow or something and prevent it from moving around. Then you put ice on the head and then you monitor the situation of the injured. So the symptoms may not show at first, but as slowly as the swelling increases, the swelling may press against some part of the brain and it can cause stuff like memory loss and all that. So to monitor the condition, people usually ask simple questions like what is your name, where do you live, what are you doing here, what day is it, things like that, to make sure that the brain is functioning properly. And then obviously you rest the head and you don't stress it too much. And then achilles tendinitis, we all know the achilles tendon, and when there's swelling in that, it's called achilles tendinitis. So again, it's similar, everything, all these first aids are very similar to each other. So you have to stop moving your feet, you have to stop moving and using the you have to stop using the tendon, you apply ice, you compress it with a anklet or a crepe bandage, you elevate it, you keep it higher on a pillow while sleeping or sitting or something, and you take anti-inflammatory medicine. Runner's knee. So this thing, it's you see the part between the femur ka bottom and the patella, that the tissue there is the one which gets affected, and this it hurts. This can be caused because of bad running style or improper shoes. So here also you rest your knee, you put ice, you wear a knee cap, you keep it elevated and you take medicine. So how do you prevent these injuries? So first of all, warm up and cool down, like we are told before sports fest all the time. That warming up is important because it activates your muscles. So if they have been dormant, not very active, very used, and so warming up activates them and prepares them for whatever activities you're gonna do next. Like if you're gonna have to sprint, then your legs are warmed up properly to do that quick contraction and expansion. And then cool down is important because when you do your exercise and when you do that physical activity, uh, during that a lot of uh, waste product is collected in your muscles like lactic acid and all that. So that needs to be washed away and removed from your muscles. So cool down does that. And these cool down, they shouldn't be warm up, and cool down shouldn't be like very quick, like you jump for a minute, half minute, you do some 10-20 jumps and you're warmed up. It should be a proper 5 minutes to 10 minutes of warm up and cool down. So fitness is also very important. So the strength of your muscles, the strength of your tendons, the flexibility and the coordination, and all of this is very important to prevent the injuries. Because if your tendons are not strong enough or flexible enough, there is more chance of them getting damaged than if they are fit and they are strong. Then equipment is also very important in preventing injuries, because if the equipment has a fault, so you might have seen equipment failing, like for example in pole vault the pole breaks sometimes. So things like that can cause the athlete to fall from whatever height and hurt themselves and stuff like that. And also the equipment should be maintained properly and renewed once it gets very old. So like in rock climbing they told us that there is like a certain time till which they use their ropes and other things, and after that they change it. So that's to prevent any mishap, something going wrong. And playgrounds should also be well maintained for kids and all that. So if the slides have like, if they have places where there is random metal plates shutting out, it can cause injuries and very bad injuries. Knowledge of the game is also important, because if you don't know the game properly, you'll it's likely to be, you're likely to do fouls, and that can result in hurting others and all that. Protective gear, by the name itself says that it's for protection, and it prevents the injuries which are highly likely. Like for example in football you wear shin guards, because it's very likely that some other player while trying to kick the ball may miss it and kick your shin. So that's a preventive measure for injuries. And breaks, you should take breaks in your games or whatever. Like all games have half times, quarters and stuff like that, because that that gives time to the athletes to recover from the fatigue of the last period of which they played, and it gives time to them to get rid of all the waste products which have been formed in the muscles. And also that you can rehydrate yourself and stuff like that. Supervision of a coach or some teacher or something, because in absence of a supervision people may start doing stuff which is very outrageous and things like that, and that can cause injuries, accidents. Training and technique. So each sport has certain techniques which needs to be mastered to prevent injuries. So like high jumpers, along with the technique of jumping and the run up and the jump and all that, they also need to know how to land. So once they've jumped, they should know how to land to avoid getting hurt in like somewhere in their head or spine. And in other games also, like basketball, football, hockey, everything, it has foot movement. So you have to train your feet to move quick enough, so you don't accidentally twist your ankle and get hurt.